Hello everyone, today we will discuss about the pathophysiology of ARDS, acute respiratory distress syndrome, which is a manifestation of the severe acute lung injury. So we will start with the normal anatomy of alveolus. So these are the lungs, and here you can zoom out and we'll see like this the cluster of alveoli with the alveolar duct. And here you can zoom out and see the multiple alveolus with their blood supply. Okay, and we are zooming in these one single alveolus. So here is the alveolar duct. So alveolar duct is lined by the bronchial epithelial cell, and alveoli is lined by type 1 pneumocyte. 95% of cells are the type 1 pneumocyte, and 5% cells are the type 2 pneumocyte. Type 2 pneumocytes releasing the surfactants which prevent the collapsing of the alveoli during the expiration. So another cell is the alveolar macrophage within the cavity of the alveolus, and they are policemen of the alveolus. Here is the capillary, and capillary is lined by the endothelial cell. Okay, and in between the capillary and the alveolus, this space is called as the interstitium. Okay, so let's start with the ARDS. So ARDS is the acute respiratory distress syndrome, and it is a life-threatening condition, making it hard to breathe and get enough oxygen. So let's take a step-by-step look at how these diseases develop and progress. First, let's start with the initial injury. ARDS are often triggered by the things like sepsis, pneumonia, trauma, or even aspiration and inhalation injury also. That's when something accidentally enter the lung, okay, like food or stomach acid, like this. When this event occurs, they can damage two important structure in lungs. First is the type 1 pneumocyte, and second is the blood capillary endothelium. So how? From the blood. Okay, if septicemia is there, then the bacteria and neutrophil will directly attack this endothelium. Okay, so here you can see, and this is the list of the conditions associated with the development of the acute respiratory distress syndrome. You can read it. So now initial injury. When this event occurs, they can damage two important structures. You know now, first is the type 1 pneumocyte, and second one is the endothelial cell. Okay, nice. So now step 2, endothelial activation. Once the endothelium, the cells lining the lungs blood vessel, get damaged or sense nearby injury, it become activated. So these plump endothelial cells are the activated. Okay, imagine. This can happen directly from the inflammatory chemical in bloodstream, like in sepsis, or indirectly from the damaged alveoli. The alveolar macrophage, the lungs immune defenders, sense this damage and release tumor necrosis factor alpha, which ramps up the inflammation, making situation even worse. So next step is the increased permeability and leakage. Next things start to get messy. The activated endothelial become more leaky, allowing fluid and protein to escape the blood vessel and enter the alveolus. This is what causes pulmonary edema. So here you can see the pulmonary edema. And importantly, it's a non-cardiogenic, meaning it's not caused by heart failure. On top of that, injury to type 2 pneumocyte, here type 2 pneumocyte means there is less surfactant, which is critical for keeping the alveoli open. Without it, the lungs can't exchange oxygen properly. So next step is the neutrophil activation and the inflammation. So this is the neutrophil. They will come here through the interstitium and into the alveoli. Okay, these are supposed to help, but instead they cause even more damage. To make matter worse, neutrophil will release the proteases, cytokine, and reactive oxygen species, and this will damage all the type 1 type 1 pneumocytes. Okay, and they are destroying it. This is not enough for them. They are now blast themselves and make the neutrophil extracellular trap, NETs. These sticky waves released by the neutrophil contribute to ongoing inflammation and tissue destruction. Okay, now step 5 is the formation of the hyaline membrane. As fluid continues to flood the alveoli, it forms hyaline membranes. These membranes are made up of protein-rich fluid and necrotic epithelial cell debris. So you can see here, this is the hyaline membrane. So how can it possible for oxygen to come from here to here? Not possible. Okay. These membranes are hallmark of diffuse alveolar damage or ARDS. They block oxygen exchange and severely impair the lungs' ability to function. The next step is impaired gas exchange by this membrane. Okay. Next step is the fibrosis and impaired healing. If the inflammation doesn't stop here, the damage gets worse. The injured epithelial cell and endothelial cells can't heal properly, and this allows macrophage to release fibrogenic factors such as the TGF beta and PDGF. This will stimulate the fibroblast and cause fibroblast proliferation. Okay, causing collagen to be deposited in the alveolar wall, leading to fibrosis, a thickening and scarring of the lung tissue. This fibrosis makes the lung stiffer and less able to expand, which decreases lung function over the long term. So you can see here the final stage of the ARDS, where entire alveolus is filled with the collagen, macrophages, and few type 2 pneumocyte. Okay, so is there any chance of healing? So in some cases, if the inflammation subsides, the lung have a chance to recover. Macrophages clear out the debris, and type 2 pneumocytes start multiplying to replace the damaged cell. But even if the inflammation stops, the extent of the damage can vary. Some patients might heal completely, while others may be left with permanent fibrotic change. Here you can see that impaired lung function even after the acute phase is over. Okay, and that's the pathophysiology of ARDS in nutshell. This is most important question in pathology. This will be asked in your upcoming exam, so please read it from Robbins. I made this entire video from Robbins. From initial injury to possible recovery, the lungs go through intense cycle of inflammation, damage, and in some cases healing. If you found this breakdown helpful, be sure to like the video, share with your friends, and subscribe to channel for more medical insights like this. I will make my videos more powerful, more graphical, and more insightful. I am just a beginner, so by the time I will make more great videos. So please support me. Thank you so much. Please subscribe my YouTube channel. Thank you so much.